time, let's talk about this. As COVID-19 continues to spread throughout the country and the world, in fact, misinformation surrounding the virus is also spreading at an alarming rate. And with so many unknowns about the pandemic, experts say this has caused many people to come up with several conspiracy theories surrounding the outbreak. So joining us now to talk about it is Associate Professor of Political Science and International Relations at the University of Delaware, Joanne Miller. Good morning, Joanne. Thank you for being with us.
Good morning. Thanks for having me.
Okay, so let's break down some of the top conspiracy theories that are circulating out there. What are they?
So one is that 5G towers are spreading the virus. Another is that scientists are exaggerating the virus itself, the seriousness of the virus. There are a variety around China. One is that China is intentionally created the virus as a biological weapon. Another is that it was released accidentally, either by China or by the United States. So there are quite a few of them out there right now.
Absolutely. I mean, just listing all of them, trying to wrap my head around the details of all of those. And I'm sure people can go online if they wanted to search more. But there is a bit of a danger, you say, to this, right?
Yes. To the extent that people believe conspiracy theories about the virus, and especially conspiracy theories around the seriousness of the virus, it could lead people to resist public health experts' recommendations regarding social distancing, regarding wearing masks, and potentially even regarding taking a vaccine when one is available.
Is some of this taking off because people have been locked down for quite a while now, and they're wanting to get out there, and they're saying, wait a second, I'm okay, those around me are okay, so maybe this is just all made up? I mean, is that helping fuel these conspiracy theorists?
It is a little bit, because what we know, one of the primary reasons for believing conspiracy theories is uncertainty. When we feel uncertain, when we feel powerlessness, especially in the face of a really negative, unexpected event, we seek out explanations. And sometimes sort of that sense making leads us to connect dots that shouldn't be connected, which can lead us down the path of a conspiracy. So the longer the virus lasts, the longer that we're engaging in social distancing and people are looking around saying, hey, right, I'm not sick, and I feel like I don't have control over this situation, that can, again, continue to spur this seeking out information and making connections and explaining the event.
Well, the problem is the explanation, right? Because even the experts out there don't have full explanations of this simply because it is so new and they're learning about it. So that's feeding into a bit of the fear, correct?
Sure. The nature of science is that when, there's always sometimes, especially at the beginning of a virus like this, where information is we're learning as we go, and some things that we thought maybe in the beginning we have more evidence now that might not be the case. So for example, early on we were told don't wear masks. Now we're told to wear masks. And again, that kind of unexpected negative, those changes enables people to maybe potentially glom onto conspiracy theories.
Yeah, and a lot of people have a lot of time on their hands, right? So they're searching the internet, they're looking up interesting things or watching interesting stories. So as people stay at home and are with family and friends, what can they do to better educate themselves so they don't fall into some of these conspiracy traps, if you will?
So one of the most important things is to be conscious of the sources of information that you're receiving. If you see something come across your social media feed and you haven't seen it anyplace else, do a little research yourself. See if other sources are reporting on this. If they're not, maybe ask yourself why they're not reporting on this. And take a step back and remind ourselves that we're all susceptible to believing some of these things sometimes, especially under the face of uncertainty, and stop and say, why do I want to share this? Do I want to share it because it makes me feel better? Maybe I should wait a little bit and learn a little bit more and see if there's more confirmation of this information before I rush to share it myself.
All right, Professor, thank you so much for your time. We do appreciate it. Hey, you stay safe out there.
Same to you. Thank you.